would not want someone with diabetes going on an Atkins diet. However, the amount of carbohydrate does vary from individual to individual. You may have some individuals with diabetes that just can't tolerate large amounts of carbohydrate, and maybe they're only consuming about 15 grams of carbohydrate a day, and that's how they're able to maintain their overall glucose control. You'll have someone else, maybe a larger man, who's able to consume 200 grams of carbohydrate daily and maintain overall good control of his diabetes. So it really varies from individual to individual. And the Atkins diet is not something that we recommend. Again, particularly unless he's changed it in the last couple of weeks. Unless it's changed, the Atkins diet is not something that is recommended for that person with diabetes.
Okay, so what are some of the best meal planning strategies that you talked in your book?
Well, I talk a lot about carbohydrate counting, excuse me, and again, that's because that carbohydrate is what has the biggest impact on one's overall blood glucose control. And there are many ways of counting carbohydrate. I talk about the gram method, where you're actually counting each individual gram of carbohydrate in the food items that you're taking in. Or I talk about the choice method of carbohydrate counting. And this is where you're basically looking at, I call it packages of carbohydrate, if you will. A slice of bread generally contains about 15 grams of carbohydrate, and that would be considered one carbohydrate choice for the individual that's using the choice method. For someone who is not using the choice method, then it's actual 15 grams of carbohydrate. We would count it that way. So just as in all things with diabetes, whether it's the choice method or the gram method, depends on the individual, their comfort level, and what we together feel will work best for them.
Okay, thank you. So the next question here is, what are some of the alternative treatments for diabetes, and what are some of the pros and cons?
Well, there's quite a few, that people are using, and most of them, let's say for an example, a strategy, maybe the glycemic index as one strategy for meal planning. It's something that can be used. However, there are, if you will, cons that go along with it, and one of those is that people will lose sight of the nutrient content and may choose foods that have little or no nutritional value over foods that have a lower glycemic index. So it needs to be a balance there. The other thing with the glycemic index is they don't have a glycemic index number for all foods, and particularly ethnic foods. You're not going to be able to find the glycemic index. So it does have some limitations associated with it. We talk about ALA as something else that is used, and more research needs to be done there as far as its benefit and usefulness in treating diabetes.
Okay. So the next question here is coming to the weight factor. So how does the weight factor play an important role in dieting or in diabetes?
Well, we know weight plays a major role, particularly for the person with type 2. Two things that happen for the individual with type 2. One is there is insulin resistance occurring, and the other, particularly over time, they may end up with insulin deficiency. So one of the things that we know, that if we can get that individual to be physically active, to lose some weight, we're not necessarily talking about getting into a bikini, but certainly losing 10, 15 pounds in many cases can make a significant difference and lessen some of that insulin resistance. And as a result, that individual may be able to stay off medication. If they're on medication, they may be able to actually take less medication. So weight is very important.
The next question here is, what are some of the common mistakes you see people making with diabetes?
One of the things, when I think of people that come into the office here, oftentimes They're restricting everything. They're eating very, very little carbohydrate. They don't think they can have fruit. They don't think they can drink milk because they look at the label and they see sugar in milk and they think that that's a bad thing. So that's one of the biggest things that I tend to see as people come into the office. They're just really restricting themselves unnecessarily, and not understanding that the total balance is what's important, and not just to avoid all carbohydrate. Also, monitoring, self-monitoring of blood glucose. Oftentimes, I see people that they're just not monitoring, and I call that groping in the dark. You can't manage what you don't know. You need to monitor your blood glucose, and that's going to help you to determine how your body is handling the food that you're eating, whether or not your glucose levels are running high after meals or right before a meal. So it's just, that's one of the things I guess for me I'm passionate about, because so many patients come in and their doctors actually told them, you don't have to monitor your blood glucose. Don't worry about it. Just come back in the office every 3 months and I'll take care of it. And that certainly is not good management of diabetes.
That's not going to work.
No.
Next question is, how do we avoid this diabetes complications, the bad diabetes complications for your feet or for your nerves or whatever? So what are some of the best methods that you talked in your book?
One of the best methods of avoiding complications is good glucose control. That's one of the best methods. It's been proven beyond a doubt that we can, with good control, if someone already has complications, we can slow down the rate of those complications. And for that person that doesn't have complications, we certainly can prevent complications with good overall glucose control. So that's why it's so important. Why it's important to know what's going on after the meal. I recommend for my patients 2 hours after eating, check the glucose, because sometimes it looks very good before the meal, but it's taking your body a very, very long time to bring that level down. And that lets us know one or two things. Either they're consuming too much carbohydrate, or they may actually require additional medication in order to manage their diabetes more effectively. But the glucose control is the key to preventing complications. And as I always tell my patients, if you already have complications, keeping those glucose levels under control will slow down the progression of those complications.
Exactly. That's good. That's good. So what are kind of exercises that you talked in the book? Do you think one has to do a lot of cardio, or do you think doing weights is also good?
Actually, it should be a combination of both. It should be cardio, a minimum of 30 minutes most days of the week, so we'll say at least 5 days weekly, and about 3 days of strength training is also highly recommended. So it is a combination. And when we talk about the exercise, it doesn't mean that you've got to go to a gym and invest a lot of money. Certainly walking, you can walk in the park, you can walk at home, in the neighborhood. If you can't afford weights, you can lift soup cans. So there are many ways of incorporating that physical activity, incorporating that movement without spending a lot of money. That tends to be one of the biggest problems that I have with my patients. They're just really resistant to the physical activity aspect of overall management. So we have a lot of discussions about physical activity.
Oh, okay. So what are some of the few things or challenges that you face as a diabetic educator today?
Well, one of the biggest challenges is the media. There's just so many diets, and every day there's a new diet that the media is talking about, and of course this captures everyone's attention, and so people come in and they want to follow all the fad diets that are out there. The other thing is we know that at this particular point in time, there is no cure for type 1 diabetes. We know with type 2 diabetes, it can be prevented. But once a person has diabetes, we don't say that they basically have cured themselves of diabetes. Certainly, they can manage it with diet and exercise alone. So oftentimes, for me, the way that it's phrased, and I think a lot of it may be to sell books and to sell particular programs. We can get rid of your diabetes. We can reverse your diabetes. You don't have to take your medication. So those things like that are really concerning for me and frightening, quite frankly.
So recently I saw in some of the magazines that reverse diabetes. Is there anything like reverse diabetes? Either it's type 1 or type 2. Type 1 you can't really do, but type 2.
Type 2, when they say reverse, the way I explain to my patients, what they're saying is basically with good control, with eating properly, getting those glucose levels under control, that again, you may be able to take less medication. So from that perspective, you are going backwards in a sense. You are reversing it. You're taking less medication. With enough weight loss, you may be able to come off medication. So from that perspective, it is reversing it. But you always have that tendency. If you gain the weight back, well then all of your symptoms are going to come back as well. So that's why, I say it never really leaves you, but you're able to manage it differently.
So you can just manage them or make them under control. There's nothing that reversing diabetes or anything.
That's right.
Exactly. So the other thing is, what are some of the training exercises that you try to teach your patients?
Training exercises in terms of
strength training.
Oh, strength training. Actually, in the office, what I talk about primarily is I'll recommend that they go and see a personal trainer who can really work with them. If someone can't afford a personal trainer, and depending on their age, we may use videos. I'll refer them to videos that will help them with the physical activity and the movement. It may be, as I said, for some people that are not able to really be very mobile, it may be chair exercises that I recommend. There's a series called Sit and Be Fit, which is excellent for people that have limited mobility. They're able to actually sit in their chair and really get a good workout. So those are the types of things that I discuss with my patients. And if they're younger and if they're already involved in a gym, well then certainly to maybe invest and sit with a personal trainer for 2 or 3 sessions just to make sure that they're on the right track with their physical activity.
Sure. So this is a final question. What is a message that you want to send out to the diabetic community out there?
It's so important to be informed. Diabetes is something that has changed as far as the treatment modalities. They've really changed. So you want to be informed. You want to make sure that you're getting your information from credible sources. As they say, this is not your grandmother's diabetes. So your grandmother's probably not the best person now to ask as far as diabetes management. But, getting involved with organizations like the American Diabetes Association, going to websites like dlife.com, there you're going to be assured of getting good, credible information in terms of diabetes management. And if at all possible, sit down and have at least one session with a diabetes educator. Probably, I'd say as a registered dietitian, you'd want to sit down with a registered dietitian who is a certified diabetes educator. And that person is really going to be able to help and eliminate a lot of the myths that you may be operating under, and also to calm your fears and to help clear up a lot of the confusion that you may present with. So those are the 2 most important things. And then, of course, follow your doctor's instructions. Do everything that you can so that you will be able to live a long, healthy life with diabetes.
Thank you. Thank you so much, Constance, for being on this show and sharing your tips and also, your thoughts with the diabetic community. So everyone, go out there and read her book, African American Guide to Living Well with Diabetes.